Hi, I'm Heidi Bassfield, Executive Director of Speak Our Minds and Speak Our Minds podcast. Suicide remains the leading cause of death for our nation's youth. It's nothing short of a continued public health crisis. And on this series, we wanted to team up with providers and talk about what children's hospitals and their teams throughout this country are doing to take on this challenge and work every single day to have things be different, better for our youth. As part of this series, you'll hear from those providers, their teams, and what they're up to. They'll talk about new practices that they're putting into place, what they think has changed about the conversation with youth mental health, what their biggest obstacles are, what they would do about those obstacles, and what they're really excited to be a part of over the next 5 years. We also feature stories from parent caregivers who really bring home why this work is so incredibly important and how we can all join and be part of these efforts as a collective to turn the tide and prevent youth suicide. Thank you for joining us for Preventing Youth Suicide, a series focused on bringing about change. Okay, I'm here with Brooke Briscoe, who's the Director of Mental and Behavioral Health Services for Wisconsin Children's Hospital. And Brooke, okay, here's the big question. What has changed in the conversation around youth mental health? How is it different than how it was even a few years ago?
I think we're having more conversations around waitlists, access to care, and getting kids in much sooner than we've gotten them in before. We don't want kids sitting on waitlists. And I think the pandemic has also kind of shifted that, right? I think our waitlists at a lot of places have grown. So there's a lot more focus on getting patients in the door, as well as early detection and prevention. I think that there's a bigger focus on that. I will say our hospital system has, for many years, been working on early childhood mental health. Proudly that we're ahead of the game. We've had a lot of providers that were specifically trained, and we're really looking at that type of programming. So early detection, prevention, access to care, reducing the stigma, another big one. We've had a whole campaign around reducing stigma around mental health. I think those conversations have really changed, and even more recently, having conversations around clinical excellence, really focusing on evidence-based care. Shout out to Jenny Welzak, who is our Director of Clinical Care, and really focusing on making sure that our providers are trained the way that they need to be trained so that we're providing the best and safest care and getting our kids through treatment, and focusing on how we can do that in a way that's holistic and caring and moving them through the continuum.
What was it like just a few years ago? I mean, you're talking about what you've sort of seen, what you're talking about more now. Let's say pre-pandemic.
Yes.
How were these conversations, or what were you talking about instead?
I think we had a lot of ideas of what could and should be done differently. And I think that the changes were moving towards action. Instead of like, well, we've got this problem. And I think what we're really, especially as a director team, is we can swim in the problem all day long. It's let's implement what needs to change. Let's be innovative. Let's be curious. Let's put everything into action instead of swimming around of what could we do? What should we do? Let's just do it. And if we don't know how, let's get the people in place to figure it out.
Do you feel like the hospital system as a whole changed its philosophy as a result of COVID, or like what's been happening over the last few years that it really catapulted the shift?
Now I have to highlight something because I cannot talk about the hospital mental health without talking about this. I think the other thing that we've done extremely well is starting to marry what some of the mental health issues the hospital, like kids admitted into the hospital, are seeing, and marrying that in with some of the programming that we can do to help those kids. So we don't want to board kids forever. We have to fix that problem. We have to have a behavioral activation team. We have a emergency response team, a behavioral emergency response team that's responding to mental health issues right in the hospital while they're happening. We have opened 3 walk-in clinics that are associated with the hospital. That is unbelievable. We're in 3 different locations throughout our state, and we are providing immediate access to care. That is very different than what we've been doing before, where it's come to our outpatient setting, right, and go on our wait list, and we'll work to provide services for you. The other thing that's happened that's been huge is our expansion of school-based mental health. We are in 85 schools across the state. Across the state of Wisconsin, doing a lot of integrated behavioral health with the schools. So providing the schools consultation, really pairing with with the schools to take care of these kids. The other thing that we are doing that we weren't doing, 5, 6, 7, 8 years ago, integrated behavioral health. We have behavioral health consultants in all of our primary care locations that are providing services. I am really proud that we've been able to be innovative, that we've had some really fearless leaders around us that are like, we have to take care of these kids. And we are figuring out where and when to best meet their needs. So I think we've done a lot over the last 5 years, other than come to our outpatient clinic.
Right.
Like we've expanded a service array to school-based, to integrated into our primary care clinics. Our child advocacy centers that we have partner that are under our children's umbrella also have behavioral health consultants. So really just meeting kids where they're at and where they need to be served. Huge. All right. So then here comes the big question. What is it going forward that you absolutely want to be involved with building over the next 5 years when it comes to youth mental health care? So personally, the direction I would like us to continue to go down is making sure that when we are assessing the kids that are coming through their door, that they are really getting a holistic assessment and we're supporting the family system within all of that. Making sure that we're able to serve that family, not just the identified patient with those specific problems. So when appropriate, making sure that our providers are following all the protocols that we've put in place for clinical excellence, but also making sure that we're looking at what does this family system need, so that when we're discharging this kiddo, the family has shifted and changed along with the kid, instead of working with our kiddo and sending them back home into a system that's remained the same. I think we will continue to advance where we're at with school-based mental health. I think we have a lot of opportunities to continue to work on access, and that means integrated into other spaces. And, where else can we provide access? Does that look like another walk-in clinic? Who knows? Are we moving in the direction of more immediate access rather than wait lists? Absolutely. And we are making progress there.
That's amazing. All right. Well, you heard it here, and we'll look forward to hearing again from Brooke and the team in Wisconsin on the progress they make in all of these ways going forward. Thanks for joining us.
Thank you, Heidi.